So it's been a very exciting time in the last 10 years of drug development in AML, with drugs that are being targeted to various mutations such as FLT3, IDH1, IDH2. We're hearing about the menin inhibitors and NPM1 mutated disease, but also we have drugs that target cell surface molecules. So let's not forget about gemtuzumab ozogamicin and how that might fit into therapy, especially in core binding factor leukemias. And in that subset of patients, KIT mutations have been shown to be prognostically important. Are those potential targets? And then the anti-CD47 antibodies appear to give benefit to patients with myeloid neoplasms as based on the early look at the data from the MyeloMATCH trials. Here's our challenge. When patients with acute myeloid leukemia are diagnosed, they are often admitted to the hospital. They are often having consequences of marrow failure with neutropenic infections, thrombocytopenic bleeding, and need heavy transfusion support. Or they may have a leukocytosis that requires early intervention. If we are going to advance the field in acute myeloid leukemia, we need to be able to identify these markers early in the patient's course so that they can be treated on appropriate studies. Secondly, we have to further define what are the best treatments in those various subsets of patients. We can wait for the next survival study to read out, but these studies take about 10 years if you look at the Ratify trial, if you look at Quantum First trial. So how can we find signals of activity earlier in defined populations of patients? And this is really MyeloMATCH is. MyeloMATCH is an NCI-funded precision medicine initiative across the National Clinical Trials Network, led mostly by the leukemia committees of the Alliance, ECOG-ACRIN, SWOG, and the Canadian Cancer Trials Group, but also with interaction with the BMT Clinical Trials Network and the Children's Oncology Group. We have developed a structure where we are developing as a group clinical trials that are randomized phase 2 studies with an early time point of looking at MRD negative remissions by flow cytometry to get an early look at whether one therapy over another might be better than what is considered the standard of care. Patients who register on this trial will have a sample sent to a central laboratory on weekdays to a laboratory at Frederick's National Labs for Cancer, and on weekends, Jerry Radish's lab in Seattle. With a 2-day turnaround, they will get back next-gen sequencing panel, fusion panel, and also cytogenetics. That will then go into what we call a matchbox, an algorithm that will assign their patient to an appropriate clinical trial. We have already developed clinical trials for poor risk AML, for intermediate risk AML, and trials are in development for core binding factor leukemias, looking at KIT inhibitors, NPM1 mutated disease, looking at menin inhibitors, and FLT3 mutated disease, looking at various FLT3 inhibitors. These studies are planned to launch in early 2023. The second part of this is how do we overcome waiting for 10 years to see if one therapy is better than another or which therapy to bring forward. And this is where we are again going to leverage the laboratory abilities of MyeloMATCH to not only look at this flow cytometry assay, but also to investigate deep sequencing using double-stranded or error-corrected double-stranded DNA sequencing to look for evidence of MRD. And the beauty of this protocol is all patients come into this trial at the time of diagnosis. No one is grandfathered in. So we are going to have information on patients from the time of diagnosis through their induction courses called Tier 1, consolidation or MRD eraser studies called Tier 2, transplant, Tier 3, and we are even planning a Tier 4, where if we identify a mutation using next-gen sequencing, we can intervene with an inhibitor to see if that maintenance will overcome overcome the biology of the disease and lead to longer remissions for patients. So it's just starting. We've been talking about this and developing it. Actually, our first steering committee meeting that I chair was in January of 2019. So it's taken us 4 years to get here, but we're very excited about this platform for developing new therapies for people with acute myeloid leukemia, and to mention myelodysplastic syndrome as well.